Hi, everybody. For those of you who don't know me, I'm Winifred Quinn. I'm one of the co-leads on behalf of Gene Axius, who you'll meet later. He is the AARP's enterprise-wide disparity strategy lead, and he asked myself and a colleague and new friend, Mary Anderson from the AARP Illinois office, to co-lead a tactic on the disparities work, and it's engaging local communities and on who effectively, community organizations that effectively address the social determinants of health for people 50 and older. So Mary and I have partnered on behalf of AARP with one faith-based organization serving the Southeast and another American Indian program working on food security for the Navajo Nation. So, and then we also asked Gene if he could give us funding for today, and he did. So thank you, Gene, when you're back. Yeah, thank you. So to help bridge the time between the panelists stepping down and the panelists coming up, in the breaks we're going to have 3 videos. And these are videos of nurses in practice. We took those videos in partnership with the National League for Nursing at their conference in Las Vegas just about 6 weeks ago. And you're going to be hearing not just from a couple of staff nurses who are here today to share what their lived experience is in the clinical setting today, but we're also going to hear these from these 3 nurses who are also out in the field on these videos. So with that, I'm going to ask our first set of panelists to come up. So everyone's met Jasmine Cooper. She's our moderator for the first panel. And with her will be Dr. Kenya Beard, Dr. Margot Brooks-Carthon, and Dr. Jimmy Reyes. So if the 4 of you can please come up. And while you're taking your seats, if Broadcast Studios could go ahead and play the first video. Thanks, everyone.
I always knew I would be in the healthcare profession world in some kind of capacity. My mother is now a retired nurse, but I grew up around nursing from my mom. And I always had a passion to care for people and just saw how it was so rewarding for her. And so I knew that that is what I wanted to do when I graduated from high school. And so right out of high school, I went into nursing school. The first program I applied to, I was waitlisted, but I didn't really let that, sway me. I went to another program and was able to start right up and started from there. And my journey as far as my career path, I started with an associate degree in nursing and kind of worked my way up from that. So I started with that associate degree level and then started working as a nurse, making that income, which was great. And then I went back online to receive my bachelor's, master's, and also my doctorate degree. Yes, it was very important to have the support of my family. Having that support system, I think, will really provide that catalyst for you to keep going in those moments where it's going to be very challenges. You're going to question yourself, why are you even doing this? Is this the right field for me? And so having that support system from your family, I think, is very important. Within 6 months of coming out of nursing school, I wanted to go back for another career. So that's how, pretty much bad my orientation process was. And so I'm glad I did have mentors such as my family, my support base from my family mostly. And then after a year, I started finding other nurses as well that took me under their wing. But yeah, within 6 months, within 6 months of graduating nursing school, I wanted to go back for something else because I felt like in that environment, going into that hospital environment, I didn't have support. I was actually, you look at the older nurses as role models because they've been doing this forever. And, I'm thinking they're going to take me under their wings. And that really wasn't the case for me. So it was very important for me to have people that look like me, not only in the nursing industry, but also in nursing school. And so I didn't get that a lot as well. And so, of course, that carried over to my nursing environment. So I think that's very important from that initial education base. We teach a very diverse population in nursing schools, and so for a student to have someone that looks like them, I think that's the same thing for nurses to have an environment as well.
Thank you. Hello again. So I have the honor of moderating our first panel. And of course, due to limited time, we please ask that you refer to their bios, to get a detail about their career history. But I do just want to thank you all for joining us today. And if we could at least have you go ahead and just introduce yourself and share your titles.
Sure. I'm Kenya Beard, the Associate Provost for Social Mission and Academic Excellence at Chamberlain University.
Hello, I'm Margot Brooks-Carthon. I'm an Associate Professor of Nursing and Africana Studies at the University of Pennsylvania School of Nursing.
Good afternoon, everyone. My name is Jimmy Reyes, and I'm the Associate Director of Practice and Education at the Iowa Board of Nursing.
Great, thank you so much. So I want to just give a little background about how this panel came to be. As for those that don't know, I'm actually not a nurse, but I'm committed to helping achieve health equity and reducing health disparities through a diverse and inclusive nursing workforce, especially since reading the Future of Nursing 2020-2030 report on charting a path to achieve health equity, which gave us the roadmap to achieving these goals. I've been with CCNA in the campaign for 5 years, and most of that time I've worked with 29 historically Black colleges and universities, and more recently with Hispanic serving and American Indian, Alaska Native serving institutions with their mentoring programs. So I'm deeply immersed in the issue of diversity within nursing. Earlier this year, my teammates and I were discussing the goal of achieving health equity. We became focused on the fact that there's so much data that supports what we know to be true, that a more diverse nursing workforce would help improve healthcare, especially from people from underrepresented communities. But what we do understand is that these studies are not widely known outside the academic and research community. It was shortly after this conversation that we spoke to you, Kenya, and discovered that you were quite knowledgeable about this topic. That's when we decided to host a panel to share the evidence on which our efforts rest with a wider audience. I'm eager to have you tell the audience about the seminal studies supporting the fact that more diversity in nursing and nursing leadership improves healthcare and health outcomes.
Thank you for that question, and I'm so happy that you're asking about outcomes. But before I answer that, think about the last time you walked up a flight of steps. Did you go one step at a time, or did you take 4 or 5 steps at one time? You probably did one step at a time, because if you tried to do 4 or 5, you'd probably fall, and you'd never make it up to the top. Now think about healthcare, and healthcare disparities being at the bottom of that staircase. And at the top is health equity. How do we get there? We have to look at steps 1, 2, 3, and 4 as being reflective of diversity. And if we do not achieve diversity, we're not going to get to the top of that landing. So some people will say, well, how do you know that? Well, over 20 years ago, the Institute of Medicine published Crossing the Quality Chasm. And in that document, they said the quality of care that we deliver on a regular basis is not the quality of care that needs to be delivered on a regular basis. And how do we narrow that gulf? What do we need to do? Well, they didn't talk about diversity. They talked about equity. They had 6 aims, and one of the aims was that we needed to be more equitable, that everyone should have an opportunity to achieve a high level of health. But what happened a couple of years after that report, the Institute of Medicine published Unequal Treatment. And in that document, I realized that what my grandfather had told me many years ago when he refused to seek health care when he was in pain, and he said, they don't treat me the way that I should be treated. Therefore, I'm not going. And he ended up dying from cancer, something that could have been prevented, something that could have been treated. And when that report came out, I was like, oh my gosh, my grandfather was right. Here I am coming into nursing in the 80s, and I was so naive thinking, now that we're more diverse, those things won't happen anymore. Grandfather, you can come in to the hospitals and be treated the way you should be treated. You know, don't let the Tuskegee study, you know, make you think that change has not come. Well, if he was around when the unequal treatment document came out, he would have said, I told you, and you didn't believe me. So here it is, 2004, 2003, and we're still having this conversation about unequal treatment. The fact that if I have chest pain and a person my age in their 50s has chest pain and they're white, I'm going to go in and be treated less aggressively. How can that happen? So I'm asking all my colleagues, would you treat me less aggressively? Would you treat me less aggressively? And what do you think they said? Of course not. Then why are the studies showing that we do? And what do we need to do about it? Well, 2004, 2 documents came out. The Sullivan's Commission report, Missing Persons, Minorities in the Health Workforce, and they said we need more diversity. And not only did the Sullivan's Commission bring that up in their 200-plus page document, but the Institute of Medicine that same year published in the nation's compelling interest, minorities in the healthcare workforce. And they said, if we do not diversify, we're not going to get to the top of that landing. So what's diversity going to do? Well, there's a list of things. So when people ask me, oh, Kenya, why is diversity so important? My heart is so saddened. And I ask them, what school did you graduate from? And they look at me and they're like, why are you asking me what school did I graduate from? Because I need to speak to your dean, and I need to make sure that that dean knows that there's a leak in your curriculum, a leak that allowed you to graduate not knowing why diversity is so important, with 20 plus years worth of documentation that supports why diversity is so important. So I'm not going to blame the individual. I'm going to blame the system. How did that happen? Especially when the Sullivan Commission report talked about the importance of making sure our curriculum prepares students and understands and understanding why diversity is so important. So you have that document, and with the Sullivan's Commission, there was a quote, and I love this quote, and I hope I don't mess it up, but they said, if you ask an economist why diversification is so important, they will say, diversification is important to have a secure portfolio. And if you ask a geneticist, they'll say diversification is important so you can have a hardy species of animals and plants. But somehow, diversity just gets lost in healthcare. And we can't seem to appreciate how important it is and how to get there. But it's not just about having the numbers. Yes, we want to make sure that our healthcare workforce reflects the population that we serve, but it's more than that. In that document, they said healthcare and diversity is inexplicable. It's linked. So we know that it's inseparable, right? It's linked. You have to have diversity in order to have healthcare quality. But also, they said we have to understand that diversity is key to saving lives. So when a person says, why do we need diversity? You're in healthcare to save lives, are you not? So of course you know we need diversity, because diversity is key to saving lives.
Thank you. Thank you so much for that. Would any of our panelists like to comment on what Kenya just shared? Yes, please. And if you could just take 1 minute to add a comment, if you'd like. No comment?
I do have one brief comment. I would say that from an immigrant perspective, I am a first-generation immigrant. I came from Chile when I was 10 years old, and just understanding and listening to Dr. Beer talk about the inequities and inequalities, and also understanding that in Iowa, for instance, in rural communities, we are receiving communities, and understanding that there's an opportunity for a lot of us to make sure that we can educate our incoming communities that are coming to our different areas, that being an urban location, a rural area. Again, is another great opportunity, which I think aligns with the mission of all the different organizations. And later on, I'll be talking more about regulations, but I do applaud and I do concur with all of this.
Thank you so much.
Oh, just ditto. Ditto, right? You know, Kenya mentioned the importance of outcomes. I'm a researcher. Research is my love language. It's a form of advocacy for me. And so the notion of the importance of evaluating impact and outcomes is essential to establishing an evidence base when it comes to the value of workforce diversity and using that to set the standards for what our expectations are for institutions and organizations. And so nothing but amen from this part of the choir.
And I just want to add, and thank you for the amen. And just to follow what she said, there's so many reasons that we know and the evidence supports. When you have diversity, you reduce racism in the institution. When you have diversity, you improve access. Minorities are more likely to work in areas that are under-resourced. And when you have diversity, you have a better healthcare quality system. So thank you for all your research.
Yes, thank you all, and thank you, Kenya. So Margot, you were the next person that we called when this topic came up. And we had a great discussion about why the research data on how a more diverse nursing workforce would improve healthcare, especially from people from underserved communities that have not been prioritized. Can you help us understand why, in your view, the data has not been a priority, and what can be done to advance and spread the evidence base, especially in research and academia?
So thank you for that question. So that question is kind of the thing that keeps me up at night. I've been a researcher for over 15 years, probably a little longer. And so one of the things I've seen is we know that there is value in diversity. We know that there is importance of workforce diversity. But when we look at our funding patterns, we have not necessarily seen DEI or workforce diversity as central in RFPs from many funders. And so in healthcare, I know what's important to you by what you fund and what you evaluate, right? And so if we're not funding, if researchers are coming into their PhD programs and they say, I want to study DEI, it's been a committee or it's been viewed as service and not necessarily a lane of scholarship. And so one of the things we have to do is shift the perspective. And we also have to ask ourselves, so I'm a health services researcher, so I'm always thinking about structure, process, outcomes. And so yes, we should be thinking about how do we diversify the workforce. But we also have to ask ourselves, once we have diverse nurses in the workforce, what are they doing that is specifically potent and impactful, right? Are they building trustful relationships? Is it something about their communication patterns? Are they using different teaching or motivational interview tactics? It's not that they just show up in their melanated skin and their magic. There are specific strategies, there's skills. And if we are to address health inequity, we need to center their skills, right? And center and compensate. So we just got finished doing a study of Black MPs, and they told us about the ways that they address health inequities in their practice. And so one of the MPs who is African American or Black MP, and she works in a practice that caters to migrant farmers. So she said, well, I am not from Hispanic origin or ethnicity, so I've driven into all of their communities to the local bodegas. I want to see what foods are available to them so that when I'm in my practice, I can provide care that's clinically relevant and tailored. This is what she's doing on her own extra spare time. And so some of the things that they're doing, which are simply amazing, aren't things that are normative or standard. But if we want to address health inequities, we need to standardize the work that they're doing, because these specific strategies are core to the reasons that we think that diversity can help to decrease health inequities. And so part of this is understanding the particular, but also understanding that increasing workforce diversity, knowing that this workforce is doing the lion's share of the efforts to address health inequity, does not come without a cost, right? Because a lot of the MPs and nurses of color that I talk to are exhausted and they're burnt out, because the addressing disparities and working to achieve health inequity is done on their own spare time because it's a passion. So they're not compensated for doing the extra chart audit or spending the extra time with patients or driving into local bodegas. It's what they're doing on their off time, and it's uncompensated. And so really thinking about at what cost, right? And sticking your neck out, because they're minorities in these settings. And so always being that person who has to go out on a limb to continue to show colleagues that the care that they're providing is racist or problematic. There's risk to that, to their professionalism. There's risk to that, and it's exhausting. So what I like to advocate for, and what I like to see us do at both the funder and the regulator and the organizational level, is to think about the ways in which these externalities impact the experience of a diverse workforce. The ANA survey just said that the majority of Black nurses have experienced racism. So they are experiencing racism, they're emotionally exhausted, and they're doing the lion's share of the work to address health inequity. We have to look at systems. We have to increase our funding support. Diversity and equity and inclusion is a lane of scholarship. The work that diverse nurses are employing is strategic. It's not just creative magic. And we need to think about harnessing, centering the work of these nurse professionals to think about ways to strategize to address health inequities by centering their experience.
Thank you so much.
You're welcome.
Would any of our panelists like to add to or comment with what Margot shared?
So I'll just say that she's spot on in everything that she said. The workforce is tired. They were tired before the pandemic, and now they are exhausted. And it's so difficult. When we talk about diversity, diversity is not code for race. Right? There's a lot that goes into diversity, but sometimes race and ethnicity bubbles to the top, and people might not recognize all of the things that we talk about when we talk about diversity. And in order to get these outcomes that are stellar, what does it look like behind the scenes? Someone is putting their career in jeopardy, right? That's the truth, because you're talking about racism, and not every institution wants to talk about it. So there's a lot to unpack. Superficially, we make it sound so simple. Just do it. Well, this is not Nike, right? It takes a lot to make this happen, and we have to understand what people are doing behind the scenes to make it happen, and the risks that they're taking.
I would also like to add as well that there's a great opportunity for a lot of nurse researchers and clinicians that are from underserved backgrounds to really take on the challenge, to really advocate for those populations. You talk about the research that is being conducted. I know of a few fellow colleagues. I actually know very few Latino researchers in the United States, and it is, again, another opportunity that we can seek and help them, support them. When I go to the hospital, for instance, I'm not practicing as a registered nurse at the moment, but I do see a lot of migrant individuals working as certified nursing assistants, and there's an untapped opportunity for them to be encouraged to go and become an LPN, an RN, a nurse practitioner, a leader. Many of them just don't see they're just not guided enough. And I think also the lack of mentorship as well. In some nursing education programs, we could do a better job with helping them and mentoring them. I was blessed to actually have a dear colleague of mine who passed away, but she mentored me and supported me, even though at times I did not agree with her philosophies, but she really pushed me on the qualitative and quantitative approach and really helped me to see the value of others, and I think that was very helpful. So those experiences, I think, really help you to look outside of the box, and I think it helps you then to motivate others. So thank you for that.
Thank you. Thank you all. Thank you, Margot. So my next question is for you, Jimmy. You were recently introduced to us by our dear friend and colleague, Dr. Adriana Perez. She thought that you would bring a unique perspective to this part of today's program because of your current role at the Iowa Board of Nursing and your experience in both practice and academia. Jimmy, the Future of Nursing 2020-2030, Charting a Path to Achieve Health Equity, urged that accreditors adopt standards for increasing student and faculty diversity. Jimmy, can you speak to how nursing educators might adapt or are adapting standards to rural states like Iowa, where there is a low minority population but a high number of seasonal migrant workers who need to achieve culturally cohesive care?
Thank you, Jasmine, for the question. And I've been very blessed to have worked for the Board of Nursing for about 10 years now. And it's been something that I wasn't really seeking to do after I had graduated from nursing school. I had a hope to go back home, and after 22 years, I'm still in Iowa. And from a regulatory perspective, I can tell you that the DEI elements and the concepts have not been really discussed up until recently, when this national discussion about the implementation of nursing programs to really adopt DEI concepts, not only to recruit new students to their programs, but also to look at policies and procedures that are already anchored in their programs and to evaluate different ways that we can engage students. For instance, holistic admission approaches has been one of them, not only looking at the objective metrics, but also looking at ways that we can interview new incoming nurses, to look at their essays, for instance. So look at their work from a different lens and not just look at the metrics. There are some research studies that talks about the impact of the sciences, and we do know that sometimes the sciences can be challenging for incoming nurses coming into the program. But I think there's, again, another opportunity to help them to provide remediation programs as well as they're progressing into their nursing education program. From a regulatory perspective, we need to make sure that the rules are clear, that they're objective, and that they're enforceable. So when we talk about diversity, equity, and inclusion, we need to find a way to actually include that language that embraces the policies that are in schools. We can't really say mandate, for instance, that you have to make sure that 50% of your incoming students are from a diverse and ethnic background, but you need to find ways to actually recruit them and actually try to get them into your school of nursing. Also, the concept-based curriculums have been really well adapted in the state, and also many of the other states in the Midwestern area have really embraced that concept of individuality, inclusion, and diversity as well. And the other thing is that with the faculty and staff policies, many times there is, again, another opportunity to bring more diverse background and diverse individuals to come and work for that specific school. For instance, there are some rules that talks about making sure that your policies are culturally cohesive, that they really provide an inclusion and a culture of success at that specific facility. The other thing that I would also add is that many boards of nursing publish annual reports, and we have several documents that can be really helpful to not only formulate an agenda for a researcher, but also an opportunity for legislators and stakeholders to really look at what are some of the needs from that state and also identify ways to embrace and bring more people to working in that specific area. So again, a great opportunity for nurse regulators. The National Council of State Boards of Nursing has published many different articles on this, and I think it is important to have more discussions with clinicians and nurse educators because sometimes there is a disconnect. Sometimes we don't communicate that we do have an untapped resource at the Board of Nursing, but again, it's underutilized. And again, also giving opportunities for those collecting the data and doing the daily work to also be from, not only from racial and ethnic backgrounds, but also from diverse LGBTQ and also the different gender backgrounds as well. So I think it's, again, another great importance to bring the nursing community together and also making sure that regulation, even though we don't speak as much, but there is a place for all of us at the table.
I love that. Thank you. So would anyone like to comment on Jimmy's remarks?
So I am excited when I hear regulators. I don't know how many of you get excited when you hear about regulators, so I was excited when Jimmy was on and to learn about his role. And I think probably because in my imagination, I think like regulation is such a carrot and a stick for us, right? Like we're regulated, we're credentialed. And so, but it's also helpful to hear that regulators can't mandate certain things. So it kind of helped me to like, you know, reimagine what regulation can do, but it also helps us set standards, create strategies and metrics. And so when we want, we want to encourage, not mandate, when we want to encourage our goals of workforce diversity, what are some of those steps that institutions can take? If you're in Iowa, you may not have a lot of, brown nurse or applicants, but, what are the broad ways you can think about increasing diversity through holistic admissions and other measures? And so I love the idea of thinking about the ways that regulators and researchers and clinical nurses can work together and collaboratively, because I think sometimes we're in silos. And so that's why I'm so excited that we're on a panel together, because I think there's so much opportunity for collaboration and really understanding kind of the breadth and the limits of what we all can do.
Thank you.
So how you feel about regulation is how I feel about funding. So, because the money works both ways, right? We can use the funding as a way to make sure you're being held accountable and say, if you don't do this, we're not going to fully reimburse you, something like that.
Carrots and sticks.
Or, vice versa, we can use it to incentivize, right? In a way to get people to do the right thing. So I am excited about the funding and the regulation. And I'm glad that we're finally, unfortunately it took a pandemic and George Floyd's murder for us to get to this place where so many people 10, 15, 20 years ago doing research around diversity, equity, and inclusion, it was not sexy. You were not getting tenure. You were not getting funded. There were no regulations. And now to see all of these different accrediting bodies and regulators and policies coming out in support of this. I remember back in grad school, one of my professors said, "How long does it take for change to happen?" And I was like, "Oh, change? 10 years? 5 years?" She laughed. And I'm like, I'm thinking I went overboard. She said 50 years. 50 years for real change to happen. Because there's so many people set in their ways that you need what you spoke to earlier. People that are coming in, that are innovative, that are saying this is wrong. How did you guys put up with this for so many decades? And some of us didn't even realize it was a problem because we're like a fish in water, right? We're so used to it. We're like, oh, wow. Yeah, I guess that is bad when you put it like that. Like, how did I miss that? I missed it because I'm part of this system, and being in it for almost 40 years, you sometimes don't realize the extent to which you are creating the problem. And it takes you to be humble, a strong sense of humility, to have someone who's just coming in saying, that's not right, and let me tell you why. And then for you to be able to listen to them and not be insulted and not be threatened, but to take them up on what they're saying and then help elevate them and bring them around other people that could say, yes, what can we do about it? What are the regulations that we need? And what are the new funding practices that we need to have, right? And listen.
Well, thank you. Thank you all so much for your comments. I want to close out today's panel discussing our call to action. So you all have a specialty, you all have an idea of how we can address diversifying the nursing workforce. So what would be your call to action to the audience, to our sponsors, to the different people in the different sectors that are here and joining us today? Who would like to go first?
Sure, I can go first. I would say that contact your board of nursing. Have a discussion with the executive director, with the education and practice consultant. I believe that many of them are very open to the discussions and making sure how the board can be of help to your agenda, to the specific proposal that you have for a research study, or if you're working on a specific document, a piece of legislation, a bill. I think that, again, like I said before, the Board of Nursing is an untapped resource that could really be of assistance. We're hoping to close a bridge and gap a bridge to make sure that we can provide the information that you need in order to then provide that specific campaign or a program. We want to be collaborative. I think there's a lot of opportunities for us to continue that communication and collaboration, especially when it comes to research and clinical practice. And one more thing, to also be a mentor. I would highly suggest that all of us here in the room and also virtually, that we can all be mentors of other students who are maybe watching and aspire to become nurses. They all come from different backgrounds and experiences. And again, I think the potential is unlimited. Thank you.
Thank you.
So I think my call to action is that we continue to put our money where our mouth is, right? And so a lot of our efforts toward workforce diversity and addressing health equity are laudable, but they take energy, effort, strategy. They take research. I am biased. But, to Kenya's point, a lot of times as a researcher over the last 20 years, the funding opportunities for people of color, particularly in federal funding, it wasn't robust, and their interests of minority researchers weren't always appreciated. Their ideas, the way they approach problems, and so we really have to make room at the table. We have to build our own tables, but at the same time, we have to reimagine what those tables look like. And so funding opportunities are really important. One, because it compensates the people who've been putting in this work for so long. And it also is evidence that we think it matters, right? It always mattered, but it really, it shows that it matters when we put actual funding and resources behind those initiatives.
So 2 things. One, read the Future of Nursing Report 2020-2030. That's a top priority. And then identify who in your institution is responsible for addressing racism. Racism is the elephant in the room that no one wants to look at. It's there, it's making us uncomfortable, we're squeezed up against a wall, and we just want to walk around the elephant like it doesn't exist. It's time for us to really evaluate our institutions. Don't run away from it. And like was said earlier, if you're not evaluating for it, then it's probably not getting done. And if it's not getting done, then how diverse will your setting ever truly be?
Well, thank you all. This was amazing. Thank you for joining us today and for your call to actions. I hope that this has been a great takeaway for everyone that's joined us in the room and online. So let's just give them a round of a hand as we close out.